are starting to even out a little bit. So I will go ahead and get us started. Thank you all so much for being here tonight. Welcome to tonight's town hall session. We are gathered here with some really wonderful speakers to present some important information that they'll be going through for the next hour with you all. Just note as you're joining, your cameras are automatically off, your mics are automatically muted, but you can use the chat, and we encourage you to use the chat throughout today to provide questions, comments, share resources, things like that. And we will have some time at the end for Q&A. So we encourage you to post your questions in there. If they're not answered immediately, we'll be going through some of those at the end. So keep an eye out for that. Also note that this meeting is being recorded and it will be emailed out to everyone within 1 week. So everything that's discussed, you'll be able to have access to afterwards, and we encourage you to share this information out after. So thank you all. And with that, I'm going to hand it over to Kelly and the team to kick us off.
Awesome. Thanks so much, Jackie. Hi, everyone. I'm so excited to be here with you all tonight. You could be anywhere in the world. I guess it's the afternoon for some of you, but you're here with us trying to make a change at a really important time for youth mental health and a time of awesome momentum for youth peer support specifically. So we are super excited to be here with you. I see some MHA youth leaders in the chat, MHA affiliates. This is going to be a great time. So welcome to our town hall to demand action on youth peer support. My name is Kelly Davis. I'm the Vice President of Peer and Youth Advocacy in Mental Health America's national office. I am in Arlington, Virginia, right by our national office. And today we'll be talking about all things Support Act and youth peer support. So as soon as I finish up, I'm going to turn it over to Karen Howard, our Senior Policy Director. We have a special guest from Senator Bill Cassidy's office, and you'll hear more about the policy issues and have an exciting discussion with two of the youth leaders from our Youth Policy Accelerator program. So please feel free to keep chatting in the chat, share your questions. We'll have time for Q&A, share about the awesome work that you're doing. And we're just really grateful to be in movement with you all and excited to see our impact together. And I will turn it over to Karen, MHA's Senior Policy Director.
Hi, everyone. I'm Karen Howard. I am originally from Maryland and currently live in South Florida. It is really a pleasure to join you all, especially because I came to work in government and politics without a lot of family or friends who knew about it. And so my goal in my work is really to help educate as many people about how they can be involved in the legislative process and in ensuring that policies that impact them hear, as MHA likes to say, we hear and receive the voices of people with lived experience as part of policymaking. So I am not sure if our first guest is on, Parker Reynolds from Senator Cassidy's office. So what I'm not seeing him here. So what I will do is give him a few more minutes to join and start with a discussion about the Support Act. So I'm glad you all are here to learn a little bit about the Support Act and the peer support provisions within that bill. The Support Act was initially passed through Congress as a response to the opioid epidemic and was major legislation to fund and authorize programs at SAMHSA, the Substance Abuse and Mental Health Administration, to be responsive to the needs of communities and states that were experiencing a lot of overdose deaths and losses due to the pandemic. To the opioid epidemic. After that bill passed, it was authorized into law, and the law expired in September of 2023. So at the September mark, we really should have had a bill passed to reauthorize those programs. But we have an opportunity to weigh in now because the Senate has passed two bills that are very much related to the Support Act and the substance abuse and mental health services administered by Medicare and Medicaid. And the House has also already passed a version of the Support Act. So we have legislative language in both chambers that has support. And I do see Parker has joined us now. So why don't we go ahead and introduce him? And then after Parker gives some remarks about his work actually on the Support Act, I can go back to where we are kind of in the process of trying to get the bill passed. Parker Reynolds is the health policy advisor for Senator Bill Cassidy from Louisiana. He has worked on the Hill for nearly a decade and is especially knowledgeable about Medicare and other healthcare coverage and insurance issues. He actually is the staff person that works most closely with MHA on a peer support bill that Senator Cassidy is co-sponsoring again this Congress, and we really appreciate his collaboration and work and just ensuring that Senator Cassidy remains a great proponent of peer support services. Parker, please come on video.
I actually am on video.
Oh.
I just can't get my video to work. So apologies for that. What you are actually seeing is yeah, I just can't figure it out.
Oh, wow. Okay.
Yeah.
Well, thank you so much for joining us. I'm
Yeah.
so sorry about the video issues. If we can get that fixed on our end, we will.
Yeah. No, I appreciate it. If you guys can get it fixed, that would be amazing because I can't. But no, thank you for letting me come talk to you. This was you know, a really important bill for my boss. You know, obviously he helped to lead the charge on the previous you know, previous effort to get peer support covered by Medicare, and we're looking to expand on that work because you know, he is familiar with what y'all do and he sees the benefit to it. So you know, we were excited to work with Senator Cortez Masto from Nevada on the Senate side. And then obviously, you know, we have the House bill as well that we are, you know, also excited to see was introduced.
Sure.
Sorry.
And if you would maybe share with everyone how your boss really initiated work on the Support Act last fall and how you all have kind of worked to put together that bipartisan package with the rest of the committee.
Yeah, I mean, you know, it really is just, we came together out of necessity, right? I mean, the Support Act was an extremely important piece of legislation when it passed in 2018, you know, but with Congress, nothing can really be permanent, right? Everything has to be created for a short amount of time. And so there are a lot of programs that are expiring in the Support Act. And so we came together as, you know, the boss and worked with other leaders in Congress to kind of look at what had worked, what hasn't worked, and move forward with a package that we hope will pass and get signed into law. You know, not very much passes Congress these days, but we've seen the you know, the impact of mental health issues and you know, sorry, I thing pop up, mental health issues and that sort of stuff. And so we would like to see as much move forward as we possibly can. Sorry, do you have another question, Karen? Sorry.
Sure. So I think a lot of the young people and the young leaders that have joined, they're not exactly certain how their input can be received by Congress when they're working on legislation. Can you talk about some of the ways that you all listen to your constituents and how their opinions and input can help with forming legislation?
Yeah, of course. I hear a lot from folks who don't work in politics that kind of are frustrated with it, and they think that, talk and they have all these ideas and we don't listen. And I can say like that's not true. I get emails all the time from folks in Louisiana asking me to look at priorities that they have and ideas that they have. And, we are very receptive to folks in the state. I mean, Karen, you can speak to, every time you guys have Louisiana constituents, we will take the meeting and we will listen and we will try and find, we'll try and find something that works. It doesn't work 100% of the time, but we are very receptive to what people say, because when people say stuff to us, we also know that that same thing is getting said back in the district or back in the state, right? And folks who are passionate enough to come up to the Hill and meet with people, and who are passionate enough to take the time to write into their office, are passionate enough to tell their friends about what they're doing, are passionate enough to tell their families, are passionate enough to, write a letter to the editor, to get on social media, right? And so we are very we are receptive to what people say. And that's honestly the way that a lot of this stuff gets done. That's how we get on bills all the time, is people, I will say this, in the healthcare world, there's probably 800 bills that have been introduced in Congress in the Senate side that have to do with healthcare. I'm just one person, so I can only, see so much, know so much in this space. And so what I really rely on is I rely on folks in the state to flag, a random Senate bill that has been introduced that's really important to them. So I know that it's important, and I know that I should take a look at what the bill is. Again, we don't get on a lot of bills. We maybe get on, 10%, 15% for various reasons, but we will take a look at stuff if people flag it for us. A lot of it really is just, there is a knowledge gap. I think if you asked 100 offices how many folks know about peer support, you might get 10%, 15%. I'm trying to think of how many folks you guys have hit on Hill Days up to this point. It is not a lot, because it is just one of hundreds of bills. But what's going to make a difference is when you guys talk to the healthcare staffer in the office, and you have the meeting, and you bring in people from the state, from the district, and explain why this is such an important provision, and explain, it's also helpful for staffers if you have stories to tell, right? It's one thing to just come in and tell me a stat about number of people in Louisiana, but if you tell me a story about, somebody in New Orleans or somebody in, Alexandria who this has really impacted at a personal level, that also makes a really big difference. So that's something I would encourage as well, when you do talk with members and you do talk with staff, is make sure you tell that personal story and that personal reason why this bill and this policy is so important to you.
Thank you so much. I think we have just like one more minute. Is there anything that you would suggest for young people who may not be voting age yet and really want to have a stake in the game and do as much as they can to be heard? Do you have any advice for them?
Yeah, I mean, I would say that we don't differentiate by email or when you guys reach out to us. If you're, we do a lot of meetings with high school kids and middle school kids who, this generation. Again, I'm 40, so I hate to talk about the next generation because it makes me feel very old. But my nephew and those guys in high school and college, like, much more passionate than the folks that I knew when I was that age. And so, don't let the fact that you're not a voting age constituent stop you from still reaching out to the office. And then kind of the last thing that I would, kind of say to that is Congress moves very slow, right? And so, I'm kind of half joking on this, but things that you talk about when you're not voting age, by the time it passes, you may be voting age, right? And then and that's the kind of thing that, if you let offices know, like, hey, my vote, like, I'm going to be voting based on, if you guys support this bill, or like, this is going to be really important to what I believe in, like, people will listen, and again, don't if you're in high school, don't just think that you won't be listened to or you'll be ignored. Like that is not the truth at all.
Thank you so much for taking time to join us today, Parker. We really appreciate your words. And we know how busy it is to be working with a senator's office that covers the whole state, and you have to hear from hundreds of people every day and try to, come up with solutions that really make as many people happy as possible. So we will let you kind of end here, and then I'm going to take the next minute to share about a little bit more about the Support Act.
Great. Thank you so much. And I appreciate you inviting me on. And sorry about the camera. I would love to be on camera. I just cannot figure it out because I'm old.
No problem. Thank you again, Parker. Have a good rest of your evening.
Thank you, you too.
So everyone, I saw a link in the chat to one of the bills that we're discussing, and just so you have them all, there are 3 bills that we're kind of talking about as the Support Act. There's one House bill which passed, it's already done, and then there's 2 bills on the Senate side, S 3393, which is the official Support Act, and then also S 3430, which passed out of the Finance Committee and has the Medicaid and Medicare provisions. And yes, just to clarify an earlier question, we're focusing on Medicaid when it comes to children and not Medicare. So just before this call, I was on the phone with a top lobbyist in Washington, D.C., and they basically said, we have to focus our efforts on the House of Representatives, because even though the Support Act already passed the House of Representatives, the Senate bills are much larger. There are much more provisions. We actually have our 4 main youth peer support policy priorities in those 2 Senate bills. But the House is saying they don't want anything extra. They want to go with their bill, and whatever the Senate worked on, it's too bad. So it's really important right now, as the committee staff on the House and Energy and Commerce Committee and the Senate Health and Finance Committees are having conversations and coming together, that we let them know whatever agreement they come to, the final package of bills, it has to include these 4 policy priorities that Dion will be able to share more about now. So I'd like to turn things over to Dion.
Hi, everyone. I hope you can hear me well. Are we sharing the presentation, Kelly? Oh, Jackie, thank you. Okay. Yeah, so hi, everyone. Good evening, hello, wherever you are. So today I'm going to talk about 4 key issues that is relevant to our session today. 1 is peer-to-peer support in high schools. 2 is peer support technical assistance center. 3 is data on youth peer support in Medicaid. And then 4 is SAMHSA's Office of Recovery. And we can go on to the next slide. So the first important key point is peer-to-peer support in high schools. First, peer-to-peer support overall is just evidence-based intervention that trains students to become peer support specialists and provide mental health support to other students. This is important because we're meeting students where they are in their mental health journey. Students are on a vast spectrum when it comes to their mental health needs. Some have had honest conversation about what their specific disorders are and want to receive treatment with their parents, while others do not really know exactly what is going on. They just know that they're feeling symptoms of anxiousness, stress, like feeling sad, but haven't really explored those feelings of mental health. According to the CDC's 2021 Youth Risk Behavior Survey, over 40% of high school students reported struggling with persistent feelings of sadness and hopelessness. And because that is such a huge percentage, we think it's really important that we continue to advocate for peer-to-peer support programs, because students are able to work together and also continue to have these conversations with one another. This leads into the second point with these conversations about being able to help break stigma around mental health care and connect students to resources that they need. Especially when we think about students of color and students of immigrant backgrounds, there's often this notion from family and their community that mental health isn't real or that you just have to work harder or stronger. I've heard it all when I was growing up. And it's also often seen as taboo, meaning that it isn't talked as much within the family unit. By having students engage with one another in peer-to-peer support, they're able to receive resources and build a community where they were once isolated and not able to understand this confusing process or just understand the process of mental health that they're going through. With that, I think it's also important that we discuss reducing access challenges for students. The school environment is often seen as a concrete and safe place for students as they spend majority of their time in that environment. Therefore, by including peer-to-peer support programs in schools, we can limit the challenges of inaccessibility and affordability as students can receive these services in school and within this environment for free. That's why I also think it's important that we really work with school districts to facilitate peer-to-peer mental health support programs. Next. Thank you. So our next key important issue that we are going to talk about is peer support technical assistance centers. And this is important because these centers enhances the field of peer recovery support services by providing training and assistance to organizations who work with peer and peer-run organizations. Therefore, there will be more support for state and regional levels, creating a network system to have streamlined support in which it supports the integration of peer services into diverse settings, such as community health settings, by sharing information, distributing educational resources, providing skills trainings, mentorship, and project and program development, to list a few. With that, it will include utilization of peer support workers who have undergone specialized training to support peer-to-peer services. Our third key important issue is data on youth peer support in Medicaid. Medicaid is the #1 payer for insurance services. 1 in 2 children is covered by Medicaid. When we think about the United States, that is a huge number, probably in the millions. Yet, we lack information about how often youth peer services are billed under Medicaid because we just don't have that data collection. This work, by being able to build data, do the research, get those numbers, we will be able to reach more youth in free and accessible ways, especially for those who are marginalized and low income. Therefore, it's important that we now start to gather resources, collect research, and build that case. Lastly, our fourth key important key issue is the Substance Abuse and Mental Health Service Administration, SAMHSA, Office of Recovery. So the Assistant Secretary of SAMHSA created an Office of Recovery staffed by a person with lived experience of a mental health condition. This is important because that person has been able to speak for the majority of those who live with mental health condition and has key information about what others may be going through. Therefore, it focuses on ideas of inclusion, equity, and peer services with provided recovery support, addressing key social determinants that influence support recovery, such as education, housing, transportation, financials, etc., and systematic reform and wellness, such as harm reduction, prevention, treatment, crisis care, and recovery support. So this ensures that activities the office carries out are informed by lived experiences. However, the office is not written in law, and therefore can be wiped out when a new administration is in office. And if it's wiped out, they can run programs that go counter to what people with lived experiences want, or altogether it could disappear. And the office has done so much work for those with lived experiences. Why would we want that to just go to waste? Therefore, as I talk about these 4 key issues here, I feel the passion in me to be able to say that the work needs to be done to highlight these issues and to continue to push them forward.
Awesome. So our 4 priorities, again, as Dion shared, are Technical Assistance Center at SAMHSA being reauthorized, codification of the Office of Recovery staffed by a person with lived experience to help with systems change, and the grants for peer-to-peer high school programs in high schools, and then finally data collection and Medicaid on the utilization of youth peer services. All of these things are in 2 bills in the Senate that passed through the committee but have not been brought to the floor, and there is no chance really that they'll be brought to the floor because the leadership has said that they want the House and Senate to work out a package together now with what passed through committee and what the House has already passed. And so our job really at this point is we're going to have a panel to go into how some of these broad policies would hit home locally and help everyone on the ground. And then it is time to take action. And we'd like to take questions, but also ask folks to send a letter to their members of Congress, making sure that they prioritize youth peer support and not leave these 4 priorities on the table when the final package is put together. All right, Amy and Dion, thanks so much for being here today. Can you share a little bit about yourself and why peer support matters to you? And why don't we start with Amy?
Perfect. So hi guys, my name is Amy Resnick. I use she, her pronouns, and I am currently a junior at Northwestern University studying social policy. I was brought to the realm of youth peer support in 2 ways. The first is that I lost a peer to suicide in my freshman year of high school. And his amazing parents founded an organization called Jack Strong 17 that first exposed me to peer support and just the incredible power it can have in uplifting and empowering youth to seek help and maintain hope, even in times of collective mourning. And then also in my role as a youth suicide prevention specialist at the state of Colorado in the Office of Suicide Prevention, I was able to watch the amazing work of programs like Sources of Strength and other like direct outreach follow-up projects, and see how their implementation across Colorado was able to really just make sure that people are able to access services that are responsive, community-based, and individualized. That's where I'm coming in today, but thank you all for joining us. I'm super excited to see everyone on here.
And hi everyone again. My name is Dion Regis. I'm currently a first-year PhD student at the University of North Texas studying counseling psychology. And for me, I got into peer support, especially in high school. I had a Big Sip, our program that we called it, and being able to have a person of color who looked like me and was a student and was older than me, being able to talk to them about really difficult mental health challenges that I wasn't able to talk about with my family. Also just didn't know how to express that. At that time, I had lost my father, so it was also really hard dealing with that and like the emotions and everything that came with it. So being able to have a Big Sip who also was peer to me because she went through similar situations and was able to coach me through that was really helpful. And then also I just had similar, just like a lot of friends who've dealt with suicidal ideation, where we also like kind of were together and like had these different emotions and impacts and didn't know how to talk about it, and also just not having that full-on support system in school. So I think all of that really forced me and pushed me to be like, okay, it's really important for students to have that peer-to-peer support, to be able to rely on each other and have someone who looks like them, is like close in age with them, and is able to understand their experience from their perspective.
Thank you so much. Can you pick one of the 4 priorities that we're talking about today in the Senate versions of the Support Act and share how one of them might impact you in a good way if it's adopted? Or someone you know, if there's someone you know that could be positively impacted by one of the four priorities. That's peer-to-peer grants in high schools, codifying the Office of Recovery at SAMHSA and promoting lived experience, data collection in Medicaid, and then reauthorization of the Technical Assistance Center, which provides trainings and information.
Yeah, I can go. I think data on you peer support and Medicaid was just important just because I know that with friends who are on Medicaid and even like my time on being on Medicaid, growing up in a low income family, support services just with mental health in general is very difficult with Medicaid and getting insurance back and stuff like that. But I think especially with you peer support, for marginalized communities and friends who have said like I've tried to get services, but either A, like my billing wouldn't go through, or like my insurance would be accepted, like I don't know where to turn to, like it's so hard to find especially free peer-to-peer support in low income communities unless it's through a community health center, which tends to be overrun and overpacked and like takes forever to find a schedule and time. So I think that one is just really important to me because I think especially when we have such a large population of youth and families on Medicaid, like more should be done to be able to make sure that billing, services, et cetera, goes through with that.
I think for me, the piece of the bill that really resonates strongly is the Peer Support Technical Assistance Center. As we're seeing 988 roll out across the country, a lot of suicide prevention networks who operate phone lines are also creating secondary peer-to-peer support lines, which is critical to address the increase in calls that these centers will experience as a result of 988. But it's also really important that we make sure that as we open additional peer-to-peer support options through the national 988 expansion, that they are supported through policy and through, hopefully, this new network of support that will just make sure that peer support employees are trained adequately and have the supports that they need to do their job well. And then I guess the other piece that I really connect with is the Office of Recovery codification. As someone who has worked in government, it can be so tragic to see the work of your colleagues just kind of disappear when it is no longer in statute or when the money runs out for the program. So I think it's really important that we get this office written into law so that this work can continue into the long term and hopefully into the forever, so that we're bringing lived experience into our government and making sure that our voices as people with lived experience are really heard in the actions that our bureaucratic offices take.
Very well said, Amy. And as someone who is a little older, not quite 40, but definitely late 30s, and as Parker said earlier, government works very slowly. Congress works slowly, government works slowly, and it's designed to not be able to, make immediate changes in the ways that smaller organizations or agencies can, make quick changes to respond to things. And, we really saw that during the pandemic, but having individuals who are doing the advocacy, who understand the value of recovery-oriented services and that not all treatments that are offered are the best ones for every individual, and that we really have to figure out through our own self-awareness and trial and error and talking to friends and family to figure out what's the best, plan for our own mental health and our own recovery that might really be outside of a clinical setting. It's somewhere in community among people that we love and care about. Can you share an example of a local program or local initiative that could benefit from one of the policies in the Support Act?
I think speaking from my lived experience, and I'll pass it over to you, Dion. When it comes to peer-to-peer support in high schools, something that is overwhelmingly common in my home state of Colorado is a program called Sources of Strength. And it really focuses on building just an overwhelming amount of protective factors for youth against suicide, be that through faith-based communities, friendships, positive mentorships, all these wonderful things. The thing that they're really trying to build out right now is peer-to-peer support. But previously, they haven't necessarily had the resources or the evidence base that they've needed to do that effectively. So I'm really excited to see how some of these larger, more locally responsive community-based programs can use the data from this act and then the specific clauses about peer-to-peer support in high schools to really reach young people and meet them where they're at.
Thank you.
I was trying to unmute, but it's so slow. I think for me, I think about maybe like Families Together in New York. Also there's another one I think is called CTACNY, but those are two like really big for youth peer support, but especially for reaching communities of color, and especially like targeted and diverse organizations. So again, like when it comes to like community health and going to community centers, but again, they also talk about needing funding or needing support in that aspect as well that Amy talked about. So I feel like for me, those would be two organizations, especially since they focus on cultural context of peer-to-peer support as well, and making sure to get in that aspect.
Thank you. I will just note that a lot of national attention in Congress has been given to other programs that could potentially benefit from some of these policy changes. That is like Youthline in Oregon, which is staffed by, teenagers, and they provide peer support through the phone, through telephone calls when someone is not in so much distress that they need to speak with and someone immediately for in a crisis, but that they are in enough distress that they need someone to talk to in the moment. And then there's actually I just want to mention a playbook for states. So while we're focusing on our federal priorities and making these changes would go a really long way, and we wouldn't have this chance again until the reauthorization of the Support Act, which would be in 2028. So it would be another 4 years before this type of package comes up again. And would need to be reauthorized. And so in addition, if you all are doing any advocacy at the state level, I encourage you to take a look at the governor's playbook, which came out in July. The National Governors Association put it out, and we highlight a lot of the practices and policies that states are already employing to not only empower youth and bring them into decision-making process for setting mental health and substance use policy, but also in just delivering services and ensuring that like school personnel are trained to effectively respond to a young person that reaches out for help. Because right now we do hear that they're not, there's really not a great response because a lot of adults don't know what to do when they hear that a young person is in distress. Okay, so I think we're about at the end of the discussion, and there are a lot of questions that came into the chat. So if you want to give any like last words or thoughts on the legislation, we can close out and then move on to the Q&A.
I think my last thoughts would be looking through the chat. It seems like a lot of people have questions about how young people can get involved legislatively, especially when they can't vote. And I've seen a lot of comments as well that are maybe addressing feeling a sense of impotency or just inability to act as young people can't vote. But I just want to address that and say, young people are overwhelmingly heard by legislators. When young people go and knock on the doors of their legislators at the state capitol, these people want to hear our voices. Your legislators want to know what you are thinking, and they really want to know how they can help your peers. So I would just say, don't be afraid to just call up your legislator, send them an email. Someone will read the email, even if it's not them, and make sure that your voice is heard. And at the end of the day, like, legislators are just people. They do not need to be like big, scary opponents or even just figures. Like, they are just people, and they are ready and willing to sit down and have a conversation with you. So just reach out and make your voice heard. That's the biggest way you can make a difference.
I agree with Amy, and I will also say, like, there's power in numbers and power in the masses, and social media is just such a unique and awesome tool that we as young people get to use. So being able to join organizations, join groups, we have the power of having Zoom meetings now. So being able to hop in on things, to just research things and join different organizations is the best way that you can use your voice as well, until you get the voting rights, whatever. But you definitely have a say in how your country operates. So definitely use it.
Awesome. Thank you so much. So I see the first question that has come in is a question about, I think we answered it earlier, what's the value of having Medicare cover peer support? It's really not a youth-directed activity, so we really don't have to go into that, Bill, but we do see that there is value for older adults and individuals who have long-term disability to also have access to peer support. The next question is, can you touch more on the data collection piece and how someone can support that effort? Well, now is the time we can actually drop the action alert link into the chat, because people can send letters to their congressional representatives to actually support these 4 provisions, including the one on data collection. So a little bit more context about the importance of data collection. We understood that the Senate Finance Committee was working on a bill, and one of the things that we asked them to do is really figure out how youth peer support services can get more attention in the states. We really wanted guidance from CMS. So that's another provision. We don't have to talk about that one today. But in addition to guidance from CMS on how states can be utilizing youth peer support specialists, we also asked for data collection on what services are being used, because if you do a search at the NIH or the CDC or SAMHSA on, utilization of peer support services, there are not many studies. There's not much data out there at all. There's one study in San Diego and Los Angeles of 13,000 youth who utilize peer support. And they actually found some really great findings, including that the disparities in utilization of outpatient mental health treatment services, like zeroed down to nothing by race. And so it didn't matter if you were white or another race, the outpatient services were utilized at the same levels, regardless, once a person had experienced and received peer support, youth peer support. If we don't have data to point to about the effectiveness, the accessibility, the great outcomes post youth peer support, then we don't have an argument for asking for better policies, broader coverage, and investing dollars into the peer support system. So one of the ways that we think data collection will be effective is once we have the data about who's utilizing the services, how often, and what are their outcomes, we can compare that data from that state to maybe a state that doesn't offer peer services and say, hey, look, the outcomes are better when peer support is offered. We should be offering these services more often, maybe even requiring that these services be offered. Now, if a person doesn't want peer support, it's voluntary. That is the point of peer support. But if they don't know about it, they don't have access to it, and they never knew it was an option, then we're missing a lot of helping a lot of people that otherwise don't really have to be suffering and struggling. So that is the reason why we have data. Now, the next question I see is, how do we propose to make these services available to homeschoolers who left public school for mental health reasons? Dion or Amy, do you guys want to take a stab at this?
I would say, and I know this is not maybe a direct address, but in my perfect world, youth peer support is not just being offered at school. And I know that's not necessarily a direct outcome of this policy, but it is in some ways. In terms of that, when we expand telephonic youth peer-to-peer support, it's for everybody. And that's really what we're doing with this second priority, which is the Peer Support Technical Assistance Center. And that if we had a homeschooled youth who called 988 and they were directed to a peer-to-peer support specialist, that would be wonderful. And that would potentially be one of the outcomes of this policy. And then I would also just say that personally, I would encourage youth peer-to-peer support to come from organizations like I see in the chat, the YWCA, the League of Women Voters. It doesn't just have to come from school or from mental health institutions. You know, anyone can be a youth peer-to-peer supporter with the proper training. And we really want to encourage youth peer-to-peer support to come from unconventional places and for people to build community everywhere that they go.
Yeah, I agree with everything Amy said. And like the school is just one foundation. But the first thing I think Amy may have said it too, but like even like the concept of telehealth and including that with peer-to-peer support services, really thinking outside the box in ways in which we can have peer-to-peer support be used. And that is a great idea. I did not even think about like homeschooling. So being able to have services, and that's like kind of tied into the Medicaid and like the idea of just like free peer-to-peer services that everyone's able to have some sort of access. And therefore being able to use organizations like the League of Women to be able to promote peer-to-peer services.
Excellent. I'll just note that some YMCAs and YWCAs are already offering peer support in the community. So I think if folks just kind of do a local search of peer support programs, they will find that there are trainings and groups or individual peer support sessions being offered. Do you all have any recommendations for someone who isn't certified or who doesn't have a degree to get access to mental health trainings to better assist with moving a safe space forward within my work? So I think this person is asking how they can grow a peer support program in their job.
That's a great question. I think I would start by just getting trained in mental health first aid or something on a personal level so that you can be a support system for your coworkers in a responsible and safe way. But I also personally really like VitalCog. This is not on behalf of Mental Health America, just on behalf of me. But like I really like this program called VitalCog that does workplace suicide prevention. So I'll send their link in the chat, but I think it could be a really effective program if you're looking for something really specific.
Yeah, and I think it's called Doors to Wellbeing, but I think they also have like a list. Yeah, Amy's like agreeing with me, but they also have like a list. And I think it's state by state, like their website. So that also can be very helpful as well.
Certainly. And I actually had something that has now left my brain because I'm seeing all these other things in the chat, but there are a lot of resources, including, I think, 7 technical assistance centers that SAMHSA has. There's also an effort at HRSA's behavioral health workforce education and training program to open up their trainings so that not only do their grantees that are receiving funding from them on peer support getting the kind of training and information on best practices, but that information is available to the public. So we're working on that. And just so folks know that the HRSA BWEP program is actually reauthorized in the Support Act as well. So there are a lot of other great provisions in the Support Act, and including the 4 that we're focusing on today. I'm interested to learn if anyone knows opportunities for organizations to come together to promote youth civic engagement?
There are so many. It is almost hard to start. But one thing I would focus on right now that I've been seeing news about is that I'm also seeing a lot of comments about like substance use prevention. And I know SAMHSA is offering some grants to bring young people together to create their own like vaping prevention programs. And I will find the link for that and send it in the chat. But that can be a really good way where if you're a community institution, you can get together a group of young people to do a project in hopes of winning this grant. Another thing would be, like someone just mentioned, having a youth council. That's a really critical organizational and institutional change you can make, is to have a youth advisory council, youth advisory board, some group of youth that is dedicated to informing your institutional and organizational policy in a regular, very leadership developing oriented way. So that would be another recommendation. And then in terms of like civic engagement, I would start by looking at groups that already exist in your area. I am very certain every state has their own list of civic engagement organizations, but I know Young Invincibles is one that's getting really popular nationwide. But I am certain there are lobbying groups in your area that focus specifically on youth that would like love to hear from your young people and love to provide them with support, writing op-eds, doing legislative testimony, all these things that can seem at first to be insurmountable barriers, but young people can very easily become trained in depth in a matter of weeks and months. So that would be my preliminary recommendations, but I'll send those links in the chat.
And also, I think like going to conferences, if you have the time, the space, the money, that is such a powerful way to connect with you. There's like, I think it's AIM Youth Mental Health. They tend to like have conferences, and there's like also like the international one. I think is like, was it like International Conference of Youth Mental Health or something like that? So basically what I'm saying is that if you do the research as well, like there's like so many conferences, they happen in so many different states. So I'm pretty sure you can find one in your state to be able to like go build connections, network, and also just put input and gain input as well, output as well.
Awesome. Okay, moving on to the next question. Any info on faith-based peer support programs? I'll just say, I think, spirituality and religion certainly have a great role in our mental health, and there's no reason that any of the peer support programs cannot be adapted to work in a faith-based space or with an organization that is faith-based. I know that SAMHSA recently put out a guide for hope, I think they call it, and it is it was put together by SAMHSA staff and faith-based leadership to provide guidance on teen suicide prevention and mental health support. And there's a lot of good information in that. So I will share that in the chat.
I will also say something that I've joined like in the last week or so is Repair the World. I'm personally a Jewish American individual, and it really focuses on the idea of using civic engagement and service as a mental health tool to, again, build connectedness in community and try to do upstream preventative factors rather than direct peer-to-peer support. But when we're talking about uplifting mental health, to me, I think that a way that faith-based communities can really get involved is through this larger volunteerism, civic engagement, spirit of fellowship work that builds protective factors for youth in the first place.
Awesome. All right. Since Dion is skipping that one, let's go to 14-year-old wanting to get teen MHA certified. I would love to get trained as an MHA trainer. Will these trainings be more readily available if these bills pass? I'm actually not sure what an MHA trainer is. But there is certainly a lot of funding for trainings in the bills. Mental health first aid. We can follow up with that person if they want to drop their name in the chat. The Support Act would reauthorize the Technical Assistance Center, which would give trainings to anyone who wants to become or offer recovery peer support. So that's substance use peer support specifically. And as I mentioned, it reauthorizes the HRSA program, the BWET, Behavioral Health Workforce Education and Training grants, and those are also to help certify peer specialists. And then Kelly's gonna take it from here. Because we're at time. Thank you so much, Dion and Amy.
Thank you so much, Karen. Thank you, Amy. Thank you, Dion. Thank you, everyone who is here with us. This has been an awesome hour. The chat has been so alive, and it's cool to see how much is already going to come just from folks sharing their information in there. So that's really great. So next steps for us. So first, we dropped the action alert that has the talking points, that has the form for you to contact your legislators in the chat a few times. Everyone who is registered, people who are here and who aren't here, you're going to get a link with that information, as well as a recording of the session and the slides. So we will have all of that for you. If you want a certificate of attendance, you'll also be able to request one of those after the session. If you want to stay involved more broadly, you can join our advocacy network, and certainly feel free to reach out to us with any questions. I saw someone at some point asked about folks who are organizing young people. So I don't think that I've mentioned this. So Dion and Amy are part of our Youth Policy Accelerator program. So since the fall, we've been working with a group of 10 outstanding young people. Obviously, you've witnessed some of that this evening. Who are leading peer support policy advocacy across the country. So definitely, if you're interested, stay involved in our advocacy network, reach out to, I can drop my email address in the chat. We're just really grateful to be in movement with you all. And yeah, thanks to all of our speakers, thanks to all our attendees, and we will see y'all. Have a great night.